Hello everyone, and welcome to our science video on the impact of the COVID pandemic on social inequalities. Today, we will explore research from France, Germany, Italy, and the United Kingdom, and we will see how the pandemic made social gaps wider in our society. We begin with the economic downturn that COVID caused in many parts of the world. The United Kingdom saw dramatic layoffs as more than 1 million people lost their jobs between March 2020 and January 2021, and millions of workers were placed on furlough. This reminds us that the virus did not only attack our health, but also our economies. The data shows that people on low incomes and those with less education suffered the most from these job losses. Younger workers were hit hard because they were more likely to work in sectors that were not considered essential. Women experienced an even stronger impact in many countries. Many working women saw their hours reduced, and some lost their jobs due to increased childcare responsibilities during long school closures in Italy and the United Kingdom. It is as if the pandemic gave everyone a crash course in multitasking, and even the best jugglers would have trouble keeping all the balls in the air. Now, let us turn to the mental health side of the story. Losing a loved one and the isolation of lockdowns added to the stress of economic uncertainty. This meant that depression and loneliness soared among those who lost their jobs or were on prolonged furlough. On the bright side, workers who shifted to remote work reported slightly higher levels of well-being, and we can almost imagine them enjoying a cup of tea in their pajamas while solving world problems from home. Speaking of remote work, did you know that the United Kingdom experienced the largest jump in working from home among the 4 countries? The high share of jobs that can be done remotely helped to cushion some of the negative economic effects in the United Kingdom. Furthermore, in France, Italy, and the United Kingdom, about half of the workforce moved to remote work, while in Germany, the rate was lower. These differences show that even in the realm of science, there are fascinating variations in how countries respond to change. Let's see how employment protection played a part in these differences. In the United Kingdom, employment protection was relatively weak before the pandemic, and this may have led to higher levels of job loss. In contrast, countries with stronger employment laws did not see such a dramatic drop in paid work. This observation tells us that government policies matter and that interventions can help protect the vulnerable. The data also reveals that as the pandemic went on, mental health challenges did not worsen in a simple, linear way. Average levels of depression and loneliness remained fairly stable, even though young people and women were at a greater risk. It is a reminder that the human mind is remarkably resilient, even when facing tough challenges. The research further shows that remote work and the furlough schemes help to prevent a mass unemployment disaster. Yet, these measures were not a cure-all for the economic and mental strains of the crisis. There is still much to learn about how long-term remote work affects us, but for now, it seems that working from home does not pose any serious mental health risks. In summary, the COVID pandemic not only affected our physical health, but also reshaped our societies. Social inequalities increased as job losses hit the most vulnerable groups: the young, the less educated, and many women. Science tells us that while remote work and furlough schemes offered a lifeline, they did not completely solve the problems we faced. Government policy can make a difference by targeting support for these groups and reintegrating them into the job market through measures like tax breaks for companies that hire young workers and those with less education. There is still much to discover, and it may be too early to fully understand the pandemic's impact. But one thing is clear: the lessons we learn now will help us build a more resilient society in the future.